Hi, my name is Shika. I'm here to talk about one of the biggest issues hospitals are facing today, a problem that has been plaguing hospitals and healthcare settings for decades now. Dr. Semmelweis, a pioneer in antiseptic procedures, worked in the Great Hospital in Vienna in the 1840s. There were two maternity clinics in the hospitals with alternating admission days. The first clinic was attended by medical students who went directly from the autopsy room to the delivery room without performing hand washing. Because of this, the maternal mortality rate was more than 10% due to peripheral fever or childbed fever. Whereas the second clinic that was attended by midwives, they saw a maternal mortality rate of less than 2%. But it wasn't until the death of Dr. Semmelweis' colleague, Dr. Jacob Kolischek, who was accidentally cut by a scalpel, by one of the medical students' scalpel during an autopsy. Dr. Kolischek's medical pathology report revealed that he died from peripheral fever, the same as the women. Soon after, Dr. Semmelweis concluded that some unknown cadaverous material caused peripheral fever. It was then that he instituted a policy of hand washing with chlorohinted lime for anyone leaving the autopsy room. Dr. Semmelweis also noticed that since he instituted the hand washing, the hand hygiene, the maternal mortality rate fell significantly. And so in 1975, between 1975 and 1985, the CDC published guidelines on hand washing in hospitals, primarily advocating washing with non-antimicrobial soap. Healthcare workers today are still unaware of the importance of hand washing, of hand hygiene. And a study was conducted across eight hospitals across the U.S. And that study was to observe and identify the non-compliance in hand hygiene throughout these hospitals. Data revealed that 41% of the cases were non-compliant. When some of these employees were asked why they weren't performing hand hygiene between patients, some of their reasons were they were distracted, the perception that wearing gloves would negate the need for hand hygiene. Some complained of skin irritations, and others just said that it was they weren't educated enough on it. I believe that to solve this problem, I believe that there should be more education. Since people are complaining of lack of education, there should be more education. There should be more observing. And once these people are caught not performing hand hygiene, they should be first educated, and then on the second offense, there should be a consequence.